when we talk about comprehensive sexual health education in schools, parents and community members feel like the more students know, the more likely they are to engage in risky sexual behavior, when all the studies and the evidence-based tools that are out there speak against that. And actually what we found is that when students or youth are well informed, they make healthier decisions, which improves the academic performance and academic outcomes. So there's a lot of education that needs to be done in our community around sexual health.
I'm so glad you brought that point up. For me, when kids become that tween or early teenage years, I generally ask parents if they don't mind to step outside of the room so that we can have that, that one-on-one conversation about sexual health and risky behaviors and things like that. And you'd be surprised at the number of parents who refuse to leave.
Yeah.
Or say, "Oh, what are you going to talk about?"
Right.
Yeah.
Or "Why do you want to talk about that?" They don't understand how important it is to have this prevention talk.
Absolutely.
Right.
And so one of the things, because, I've experienced that as well, one of the things that I try to do is kind of give them an outline of what the interview and what the visit will be like. I'm going to talk with you guys together. Mom, I'm going to have you step out of the room, and then we're going to talk again together. So when I present it that way, then they're a little bit more receptive of stepping out of the room. And then, I try and get the parents comfortable with me to let them know that, hey, we're on the same team, So when I present it that way, then they kind of see. But most times, I've experienced that as well, where they don't want to leave the room.
Another big issue is that they fear the unknown. So we held focus group at the St. Louis County Health Department around sexual health. So we provided our sexual health 101 course to a group of youth as well as their parents, but we had separate tracks for them. And so what we found was that the parents have the same questions that the youth have. And so if we're charging them with being health champions in the community, but they don't have the tools or the knowledge to do so, we're really setting them up for failure. And so being able to engage them in a way, engage them in a safe space, so they're willing to learn, but also have discussions around sexual health and how to have sexual health talks with their youth is really important.
Absolutely.